We're going to talk about reasons for headache and neck pain. I'll start from the front and work our way to the back. The most common problems with headache, especially this time of season where there's a change, would be sinus congestion. Believe it or not, there's several different sinus cavities in the front of the face. Frontal sinus, maxillary sinus, two others behind the frontal sinus called the ethmoid and the sphenoid sinuses. The lining of these hollow cavities is the same lining as inside the nose. So when you produce a lot of snot and discharge inside the nose, I guarantee you're also producing that in those hollow cavities. The thing is, the hollow cavities do have a drainage point. So all of them will have a small connection to the inside of the nose and then out the nostrils. So if the nose is not too swollen, then all that discharge, whether it's in the nasal passage or inside the sinus cavities, the nasal discharge will come out. Once you have complete obstruction of the nose, from chronic breaks in the nose, from excessive stuffiness due to allergies, and sometimes these sinuses can't drain out. When they can't drain out, you have a lot of pressure in those areas, and that'll be reflected as headache. Most common headache would be right in the front, where the sinuses are. But sometimes if you have congestion and throbbing and inflammation towards the ethmoid and sphenoid sinuses, you'll have pain directed to the top and sometimes even along the back of the skull, sometimes even down the neck. I've actually seen people, not necessarily with the sinuses, but people have TMJ, temporomandibular joint syndrome, from either grinding their teeth too much, chewing the wrong kind of food, or public speaking. They would have headaches along the side of the face and down into the neck too. The bottom line is that there's multiple reasons for headaches, but you always have to get your doctor to listen so that they can rule out or rule in the proper diagnosis, reason for the headache, and then treat properly. Otherwise, you're just being on a whole bunch of medicines and you'll be suffering. So the sinuses are one thing. Keep the nose open, the sinuses drain out. Keep yourself allergy free. Stop taking in foods that are high in allergen, especially during season, and that'll be hopefully the one less reason for a headache. Other reasons, the eyes. When you have problems with vision, whether it's distance or close up, sometimes you'll want to squint. Sometimes squinting changes around the focal point, and that will help with certain vision problems. But it also frowns up the forehead, and that's a muscle. When the muscle, after a certain amount of time, is kept in contraction, that will cause muscle spasm. That headache will cause pain to the frontalis muscle, which is, again, extends to the backside and cause all the other muscles that interconnect with it to also spasm, resulting in trapezius spasm, back of the neck spasm, spasm down the back. So you can see how one muscle will cause a spasm to the next muscle, and you'll just have this ripple effect of discomfort, all from reading or not using glasses properly. Other reasons for headache can be disc disease. Right here in the cervical spine, that's the neck portion of the backbone. The cervical spine is made up of 7 bones. The 7 bones are to provide for range of motion, extension, flexion, and then rotation and side bending. But they do that because there's little discs that separate each bone. Those little discs provide a space between the bones so that nerve roots can come out from the spinal cord. The nerve roots are very delicate, so when the nerve roots are pinched on each side, it can result in a pinched nerve. The most innocent pinched nerve is just aches and pains to the neck. Sometimes an ache and pain to the trapezius. Sometimes, in its worst case, a shooting pain down the arm. There's something called double crush that sometimes happens. Wrestlers get it a lot. You'll have an irritation of the nerve as it exits up here. You'll have an irritation of the nerve down here in the wrist. And yet they'll be treated as a carpal tunnel syndrome when actually it was a problem that originated up here. Truthfully, double crush, you have to take care of all areas of stenosis or crushing. But the bottom line is that you can have these tiny spaces irritate these tiny nerve roots. So another thing to keep in mind when you're dealing with chronic neck pain or headache. A pinched nerve here can always throw pain into the frontalis muscle, just like a pain over here can throw discomfort into the neck, it can go backwards. Again, that's called referred pain or trigger points. In acupuncture, when we have a lot of headaches, sometimes we'll put small acupuncture needles into certain specific points that will relax the trigger point and hopefully relax muscle. When muscle that's been spasmed causing pain relaxes suddenly, usually the patient will notice that there's no more discomfort. At least it might be fleeting, but at least we know we're in the right direction. So discs in the neck space, if they're large enough or irritated enough or herniated out, they will completely obstruct or impinge a nerve, and you will have nerve death, usually in the form of persistent numbness, decreased reflexes, or decreased strength, not to mention just unsatiable pain. So sometimes what we'll do with that is a neck collar that supports the head and lifts it off, decreasing the pressure to the disc. But it also, when you wear a neck collar, a soft collar, it also does most of the holding for you, and some people just get lazy and get used to having a neck collar, so that when they take the neck collar off, they're even weaker than before, resulting in more spasm and pain or disc impingement. What can sometimes happen too is there are ligaments between these bones that sometimes spasm up, whether it's a spear tackle, hopefully done unintentionally, a neck bridge during wrestling or mixed martial arts. Sometimes watching a belayer. A belayer is a person that helps a rock climber climb up and give support with ropes. A belayer is always looking up, and when you go rock climbing, say once a week, and you're like this for about 2 hours watching your partner and supporting him from falls, this can get to be irritating to the neck muscles because we're not used to that position. People with whiplash, when this 10-pound head gets forced to go forward suddenly and then bounces back against the headrest, there's a lot of shock movement and it pulls on muscles of the trapezius and the neck. It's not like a biceps tendon pull where you just bleed and you have a big amount of blood and hematoma. There are multiple tiny pulls all along the muscle that slowly leak out over the course of several days. Thus the reason for delayed pain when you have whiplash. Other things that can happen too are skull fractures, problems with the blood vessels inside the brain tissue problems, tumors. There's things called arteriovenous malformations. All these can be causes, even bleeding inside the brain, around the brain, can be causes for headaches as well. But again, the most common will be musculoskeletal. I just wanted to talk about this because if you see that the majority of headaches come from muscle, whether it's the tension headaches, classically known to wrap around the head, or the ipsilateral one-sided headaches of a migraine attack, or just trapezius muscle spasm and trigger points, the idea, if it's muscle, is to decrease muscle spasm as soon as possible. But again, you have to recognize what caused the event and how to correct it. Many times when we're practicing poor posture in a chair for 8 hours at a time with no elbow support and a computer ergonomic system that's just very unhealthy, you're bound to have headaches sooner or later. Or you're bound to have impingement at the wrist, elbow, and shoulder, and then that will cause more wear and tear to the trapezius and the skull. So either way, one of the biggest faults that we have with working on computers for such a long amount of time is the poor posture. I have young people who are gamers, and all day long they're lying on the ground, kind of, I'll just mimic the position, but they're kind of just going like this while watching the TV straight ahead, and when it's their turn, getting up on their elbows and playing like this. It's not a healthy position. Even if it is in a prone position on the ground, your head is almost like the belayer headache or the belayer neck, where you're constantly looking up like this, and your neck is just not built for that. And for that, sometimes physical therapy is necessary. Physical therapy can be used to strengthen and help the muscles back here get used to the endurance that they need, help stretch the anterior muscles so they're used to this kind of positioning, or at least get the trigger points taken care of so that the patient won't be suffering so much. Once you start to have pain and the brain says there's discomfort, then what usually happens is the brain fires up a message to the muscles to tighten up even further. It's a bad feedback. So interrupting the pain cycle with physical therapy, hands-on manipulation from a chiropractor, massage therapist, even in the form of a yoga practitioner showing you how to stretch out and perform your own practice so you stay supple every day, would be a preventative way to take care of the impending pain that's coming. But again, it has to be a practice. Just like meditation has to be a practice before the stressor, yoga and flexibility has to be a practice before you belay your climber, before you play the game that you're going to be playing for 3 hours, before you go watch a movie in the front row where you're the last person to pay for a ticket and you just have to watch the movie in this bad position, paying for it later on. So all those reasons, a new job, all those reasons will be good enough to consider at least a preemptive strike. Physical therapy, yoga healing, some form of flexibility, range of motion, or even if you can't do all that stuff just because you're so cooked for time, then at least getting a muscle relaxer, topical medications in, or trigger point massage with a Theracane, they will all be important. I love the use of the acupuncture needles. When I was very active with acupuncture in my clinic, I would have people coming in with headaches all the time, and I had one lady who came in with chronic headaches, at least 10 years. I think it was because of her husband, but anyway, after I came back from my UCLA certification for acupuncture, I threw in some protocol needles to spaces or acupuncture points that were common for what I thought she had a deficiency of. And within about 30 minutes, she had no pain. That was the first time in 10 years, no pain. It only lasted for about an hour, but still, that was a way in for that lady to say she didn't have to be on tons of pain medicine. There's another way to go around the medicines. It sometimes gives, even if it's an hour, it sometimes gives a ray of hope. So acupuncture is great. It's hard to take a medical diagnosis like temporomandibular joint syndrome, migraine headaches, tension headaches, disc disease. It's hard to take that diagnosis and go to acupuncturists and say, can you take care of this diagnosis? The acupuncturist will usually want to check pulses, read tongues, look at color, and then design an energy circuit, or at least an energy movement series specifically for the patient. It's very tailored, personally tailored for a patient in particular. All the points are old, 25 to 5,000 years old, but we pick and choose points depending on what deficiencies we find or what imbalances we find. Then depending on that, we get energy moving. In its easiest sense, and that's all very esoteric, very different from what we learn in Western medicine, but if you've had any problems with chronic pain, I challenge you to try an acupuncturist, a good acupuncturist, and see what they can do for you. And truthfully, a good acupuncturist will not let you talk too much. They'll check your pulse, check your tongue, and they'll start doing a couple things. Again, whether you use the Western modalities of chiropractic, physical therapy, massage therapy, or the Eastern modalities of acupuncture, the idea is when you get the relief, you work during that window of pain-free state, then you work on making the lifestyle change. And the lifestyle change has to involve exercise, relaxation therapy, and definitely relaxation therapy helps. Meditation, it helps. Remember when I talked about chronic pain and how there's a positive feedback when the brain is suffering, the muscles will tense up more, and that'll cause more trigger point until the brain more pain. That'll cause the brain to say more tension. You see that positive feedback. Well, when you interrupt that with a painkiller, it stops at least one reason for spasm. If you interrupt it with relaxation practice, taking care of the stressor when you're exposed to it, then it interrupts that cycle of pain. So that's why it's also important. So activity, thinking, and then nutrition. If you're on a crappy American diet, high in omega-6, no fiber, a lot of sugar, muscle pain doesn't necessarily turn around, but inflammation worsens with bad diet. That's why it's important to include that in the whole mix. And that's the anti-inflammatory lifestyle that I always speak of in a lot of my videos. If you want to get rid of chronic pain, get to the guys that I've just mentioned. Try the things I just mentioned. When you have good relief, whether it's an hour or a day or a week, use that opportunity to make the lifestyle change until the spasm and pain comes back. Then get back to the guy or the person who will help you relieve it. Get that window again. Apply that lifestyle change. Keep on going back and forth until your lifestyle, until your windows of pain-free state become longer. until you just become very used to the lifestyle change or adopt it, and it becomes second nature to you.